I'd like to welcome the third presenter, Professor Mohammad Akram. He's a professor of sociology at Arga Muslim University in India. He's interested in the field of sociology of health, sanitation, education, and social policies. He remained convener of Research Committee 12, Population, Health and Society of Indian Sociological Society for 4 years. So now, let us welcome Professor Mohammad Akram.
Thank you very much. So I would like to thank the organizers for inviting me for this very academic and timely conference. And I would like to thank my previous presenters for presenting two beautiful cases, Vietnam and Japan, who have very successfully handled the COVID-19 situation. Zakia was talking about the other side of the problem, basically related to several other countries. And she was highlighting the problem related to women. Uh, my presentation, basically COVID-19 and lockdown, abrupt measures and never-ending social miseries. Perhaps I'm not going to present such a positive handling of the situation, maybe something not so great about the phenomenon. But one thing I must uh, share at the beginning, that very often we mix up the cases, the situations related to COVID-19, and then the situations which came into existence because of the combat measures or the lockdown kind of situation. So for me, the biggest situation was, the biggest problem was to situate the problem. And I have used actually two different situations to understand the situation or the perspective, to develop the perspective. And should we focus on consequences which are related to premature mortality, spread of morbidity, and unseen and seen disabilities of known and unknown types, or the socio-economic and politico-cultural consequences caused because of the pandemic? So one thing is the health related consequences, and second thing is the socio-economic consequences. Do we need to look at these things at one point of time or separately? That is the first problem. Second one is this: are the consequences caused because of the spread of COVID-19 the only concern, or the consequences of the abrupt measures adapted to combat the pandemic also need to be assessed? And the second situation is this: whether the pandemic is the only problem, or the lockdown is again a problem. And basically in India, we realize that the second aspect of the problem is equally important. And for that, basically, I have presented here the situations related to lockdown here. Although the first case was detected in the month of January, the first phase of lockdown was implemented in the month of March, and we had 4 different phases: 25th March to 14th of April, 15th of April to 3rd of May, then 14th to 17th of May, and 18th to 31st of May. And then these were the periods of complete nationwide lockdown, almost complete. Now, in India, basically, we are a 1.3 billion population. It's a federal structure. There are more than 25 states and union territories, and a huge country. We are the largest democracy. And then nationwide, I mean, you can imagine the situations related to nationwide lockdown. And then the unlock basically are nothing but the partial lockdowns. So the first phase was almost like a lockdown, and then this is the 5th month of unlock. That means in India, we have witnessed situations related to lockdown right from the month of March till now. So this is a very huge problem. So as I stated that I have tried to see the problem in 2 different situations. One is the health related and the socio-cultural consequences, and then the problem as a COVID-19 as one problem, and the phase of lockdown and unlock as another problem. So 4 different situations are actually coming into existence. But when I'm talking about this lockdown and COVID-19, we do need to have some kind of understanding of the numbers, because the numbers are important. And as it was told that in Vietnam, already the cases have been controlled. In India, basically, when we had the first phase of lockdown, there were 10 deaths on 25th of till 25th of March, there were only 10 deaths, and the total number of cases were 606. And when we had the end of the fourth phase of lockdown, there were 5,164 mortalities and 182,000 cases. And as of today, basically 30th of September, 30th of September, it was, I mean, 6 million. So what has happened that the cases kept on increasing despite the lockdowns. And this continuous increase in the cases and the mortalities kept on damaging the social structure of the society. So the problems are actually health related as well as socio-cultural, and we need to understand. I've tried to take into consideration multiple dimensions of the problem. So if we see who got affected because of the health related consequences, we identify three groups of persons: infected persons who got directly infected, then the family members, and then the care providers, the frontline workers. And very pathetic situation this is, that actually all the three groups of person witnessed mortalities and morbidities. And not only that, basically mental and social health problems, and then the heart and brain strokes. So severe health problems basically emerged, and not only among those who got infected, but also those who were the family members or those who were the frontline workers. And then this created another situation. Basically, I would like to highlight one thing: the weak and vulnerable people got further weakened. Basically, all those weak and vulnerable, I mean, those who were already sick, those who were already suffering from comorbidity, or those who were the aged population. So there were further severe impact on their health situation. Then second situation is this, that the health related consequences caused because of abrupt and unplanned lockdown. Now, this is no less severe than the first situation. And in the month of April, basically in India, all the newspaper and the basically the print media were having all those reports. And many among you are familiar with these things. People dead in road accidents and railway tracks, then death of children and other during the travels, then death due to lack of food and suffocating pains. Then serious patients basically who were unable to get health facilities in the hospitals, then the mental health, hunger, and this lack of immunization of children because of the closure of the hospitals. So increased death, morbidity, and disability from preventable situations, but because of this lockdown, we witnessed all those things. Then comes the second important part, that the socio-cultural impact. Now, this is very important. I'm a student of sociology. I need to talk about these things. Basically, what happened that because of the communicable nature and because of the kind of problem, the social distancing and the problem of untouchability that was prevailing in this part of the world, some kind of stigma actually came into existence. This stigma, this physical distancing got somehow converted into some kind of untouchability sort of thing, and stigma and discrimination and social isolation came into existence. Now there is a situation of triple victimization. Now, as a student of sociology, we need to understand the self and the society. Person who got affected, they got victimized by themselves and the society. But unfortunately, what happened that in certain cases, state also became one agency which created some kind of victimization. And then in this whole situation, actually class, gender, religion, caste, and age became inequality multiplier and deprivation multiplier. Now this is a very typical situation when all these agencies or situations become deprivation multiplier. And then we now come to the other situation, the socio-cultural and politico-economic consequences caused because of the abrupt and unplanned lockdown. Now, more than 10 million people actually in the organized sector and 100 million people in the unorganized sector, almost as per different reports, lost their jobs. Absolute situation of resourcelessness. People who migrated from larger cities like Delhi, Mumbai, they are jobless. Then increased marginalization of the unemployed people, sick people, disabled and children, and then increased domestic violence. Again, gender, caste, religion, and age became inequality and deprivation multiplier. So basically, now we are witnessing a kind of situation which perhaps India has never seen before. So all these things have created the never-ending social miseries. Just half a minute I will take. Return of communicable and infectious disease has, it's a challenge for the epidemiologists world over. Are we moving towards a sick society? Then the way the social fabric is actually getting affected is another concern. So what is happening, that health is creating different kind of challenge, and the policy making and governance is creating a different kind of challenge. So if we go by the experiences shared in this part of the world, we see that the world is is about to face a severe challenge, and we need to be more empowered. We need to be prepared for social and civil empowerment. So thank you very much. I think there are few things which I could not explain, but I will certainly take up during the question hour. Thank you very much.
Thank you very much, Professor Akram, for that presentation. Now I welcome back Professor Miwako to let us know about our next speaker.
Thank you, Ina, and thank you, Professor Akram. Yeah, it was a really yeah, wonderful presentation. We learned a lot from your talk.